Tonight, we zero in on a problem affecting mothers across our state. Indiana still has one of the highest maternal mortality rates in the country, according to state data and research by IU. WRTV's Rachael Wilkerson explains the way a local nonprofit is helping provide a safe space for new and pregnant mothers.
Being pregnant in Indiana is not the safest feeling, but also being a Black woman, our outcomes are even worse, disproportionately worse.
Dr. Nicole Carey is a mother of 5. She says because Indiana is one of the top 3 states with the highest maternal mortality rates, she decided to explore having a doula for her last 2 pregnancies. She says a doula is an advocate for the mother and can specialize in birth or postpartum support.
I wanted a little bit extra support. And when I tell you my doula was an advocate, that is an understatement.
State data says 80 pregnant women died in Indiana in 2021, with Black women more at risk. Contributing factors to high maternal mortality rates include access to services, with some counties lacking a hospital, quality of care, and maternal care deserts, a shortage of OBGYNs.
It's insanity to do the same thing over and over again. And this statistic around maternal mortality has been an issue in our community for decades. And so we have to change the way that we see how we take care of each other, and we have to change the way that we approach wellness.
Dr. Carey decided to create the nonprofit Just Community to help others going through a pregnancy or postpartum.
The research also tells us that having a doula lowers cesarean rates. It changes the outcomes that we're seeing. So it's not just a good feeling. It's actually something that research is supporting as a really important part of lowering that maternal mortality rate and also infant mortality.
Bridging that gap is something Sissy Stevenson says is encouraging.
When I went to the hospital, it was scary. It was very, very scary.
When she had her son Brandon decades ago, she felt there weren't enough resources to prepare mothers.
Because I felt like 20 years old, I was young, and I didn't know anything.
She hopes young moms will explore birthing options. Rachael Wilkerson, WRTV.
Well, Just Community is currently providing doula services and certifications for new doulas. Having a doula during or after a pregnancy is not always covered by insurance, which Dr. Carey says is another challenge for pregnant women.